close to my heart, part of my personal story, and my firm belief it is a topic we need to talk about, we need to elevate, and we need to address as a community, as nations. But before I dive into this topic that I'm extremely passionate about, let me introduce you to three change makers, global influencers, and women of power and purpose that we have on here. So the first, I have Dr. Eleanor Nwadinobi. Hello, Dr. Eleanor. Dr. Eleanor is a human rights activist and an international president of the Medical Women's International Association. And next we have Samira Ghosh. Hi, Samira.
Hi,
Samira is a director of advocacy with Asian Family Support Services in Austin, Texas here, and a dear friend of mine and part of my journey. Thank you, Samira, for making time for us. Absolutely. And last but not the least, we have O'Malley Dunlop, adjunct professor at School of Law, University of Limerick, and management and organizational consultant. Thank you, ladies, for making time for us here. My goal here is to be the one to speak the least, because I want everybody here to hear your nuggets of wisdom and your take on what would it take to really tackle what I call a silent pandemic. Domestic violence is not new to our communities. It is something that has existed for decades, if not generations, in cultures around the world. It is influenced by the cultural nuances, by the community expectations, by laws, by social expectations, by policies or lack thereof. Especially in the last 12 months of pandemic, we have seen a monumental rise in domestic violence, primarily against women, but also against men as well. Just a quick bit of stats, just in a small town, relatively speaking, a small town of Greenwich, Connecticut, there has been a 30% increase in the rise in the calls against domestic violence to the hotline. Now, I particularly bring this up because Greenwich, Connecticut is a community that has the highest net worth here in USA. So what that tells us is this silent pandemic of domestic violence is really not limited to what we would most oftenly but erroneously presume to certain social economic strata in our society. It is not just limited to women of lower social economic strata, women of minority with certain races, though it is more prevalent in that, but it really crosses all the demographics, all social strata. So it is also something that pushes us to really re-examine a lot of assumptions we make about domestic violence, a lot of erroneous presumptions we make about it, and sometimes that lead to us not acting upon it because it's not my problem. It's not something in my family. It's not something that impacts the community I live with or workplace I live with. But I challenge you, it is in one form or another because it's not talked about. So with that, I'd like to start with, what do you guys think? Why have we seen this exponential rise in domestic violence, particularly in the last 12 to 18 months as pandemic has swept us globally? Dr. Eleanor, I'll start with you.
Yeah. Thank you so very much, Shaillee. We have seen an exponential rise because women especially have been locked down, locked in with their abusers. Think about it. Here we have a 100% preventable, and I want to emphasize preventable issue, because domestic violence is preventable. But then women, especially who have abusive significant others in a village in Nigeria, will get up in the morning, put her bucket on her head, go to the stream with her friends, and that is her downtime, it's her away time. But under the condition of lockdown, no movement, and in the same space with the abuser. Yes, it's important because if we measure things, then we can address them. So in Nigeria alone, in the first 2 weeks of lockdown, there was a threefold increase in violence. Here's the thing, the UK charity Refuge recorded a 700% increase in hotline calls in a single day. In South Africa, you had 87,000 incidents of gender-based violence, which is expanded in the first 21 days of lockdown. So those stats are important. As a physician, we also have a situation where, sadly, even some of my colleagues don't recognize domestic violence when it walks into their consulting room. A woman might say, I fell down the stairs. And yet it could be that she has suffered domestic violence in her home.
Thank you, Dr. Eleanor. So true. We fail to recognize the telltale signs. Either we fail to recognize because we're not educated in those, or we choose to not recognize. And I think it's definitely something we need to talk about. Samira, I'll start with you. You focus a lot on the South Asian community,
Yes.
in general, and your take on, and I know when we talked, you mentioned there has been increase in the cases that are reported, not to mention many that go unreported. What, according to you, are the reasons?
So we not only take care of South Asian survivors, but all Asian, Pan-Asian, immigrant survivors, African survivors in our basically marginalized population. And what we have noticed, definitely a huge increase. And what I think is causing that, because on top of those added economic stressors and social stressors, that people do not have an outlet, to be with your abuser for that additional 10 to 12 hours a day with no rest for the mind and body is excruciatingly painful for the survivors. All our clients who were hoping to have the marriage last and is still living with the survivor during the pandemic wanted a divorce, though the courts were closed. So they were reaching out and enough was enough. And it was like living in a pressure cooker of fear and anxiety, the whole family. The children are working from home, like they are doing their schooling from home. Both parents are working from home. So you're managing basically 2 jobs of doing your whole full-time job plus you taking care of your family. And an alarming trend that we saw was the rise of incest in our households, which are already struggling with domestic violence. There was grooming happening, and children were in harm's way. So it was a very difficult year where we could not meet our clients face to face, and all casework had to be done on Zoom and remotely. But I think that extra additional time with the abuser and constantly being in this pressure was the breaking point.
Thank you. Ellen, what have you seen? Yeah.
During the first lockdown here in Ireland, I acted CEO for a domestic violence services that employed 50 people. And like, the Greenwich, the increase in the numbers ringing the hotline was at least threefold. And again, from the cross socioeconomic, divide, there was a huge increase. And sadly, we weren't able to accommodate the numbers of families who were coming to us. But it was like what people were describing, like it was like a pressure cooker, at home, with, again, even where women, as you say, Dr. Eleanor, the women go to the well and to get the water, and they get a bit of respite. Here, women taking children to school and meeting other women, that none of that was available to them anymore. There was no outlet at all. So everything started to build up. And I'm glad to say that the government here got together and there was an all of government response to putting out awareness raising to say we are still here to anybody who was a victim of domestic violence. And it was, so we set up different types of ways that women could access support, not just hotlines, but other ways, maybe WhatsApp, different types of, because sometimes the women were denied their mobile phones or access to their phone lines. Like, this became part of the abuse that was visited upon them, more keeping them under control, so much more than they had ever experienced before. So the women were trying to be innovative in getting the support. But of course, a lot of women who may not have spoken out before were forced, thankfully for them, were forced into getting the help that is there. But before, they had been so ashamed of what was happening to them at home. And that was the big block to them actually speaking, was the shame. Shame that, and also self-blame. And of course, no woman or man who may be a victim of this type of abuse is to blame for it. Absolutely not. I ran a rape crisis centre here in Dublin for 10 years. And that was one of the big things, was to say, to those who were victims, this is not your fault. And so often that is how they feel, that it was their fault, that they brought this upon themselves. And of course, it is so important to repeat over and over again, it is never the victim's fault. Never.
Ellen, I want to dive in a little deeper on this shame and blame that is so prevalent on there before we get into the workplaces and what we can do about it. It is so integral to why this problem has existed for decades and generations, is because it's laced with this shame and blame. Speaking personally as a survivor of domestic abuse, I will tell you, I experienced it. It overtook me for years because I couldn't find the courage to speak against it, because somehow it manifests in your head that you must have done something to cause it. And then you are in there, and then it's like, what, I've stayed in there long enough. Now I'm too embarrassed to go out and say that it's part of my life and I've accepted it. And lastly, the fear that if you come out, people will blame you, people will shame you, maybe nobody will believe you, nobody will support you. That also prevents you. So let's talk just for a few moments on why is it laced with shame and blame culturally, across cultures. And it's not just limited to my South Asian culture or here in US. And looks like Samira probably ran into some network issues. She'll join us here. But Dr. Eleanor, I'm interested to say, do you see that as a common theme in the environment you work in?
Most certainly, Shaillee. In fact, I call it, the 3 S's of shame, stigma, and silence, where the survivor, the burden of proof is put on the survivor. And exactly as Ellen was saying, where the survivor feels that she is to blame. I tell you, even though it's a dated study that was done in 2010 by the British Council here in Nigeria, called the Gender in Nigeria Study. In the southeast of Nigeria, over 70% of the women felt that their husbands had a right to beat them if the food was not ready on time, or if they came back when it was dark. So, that mindset that, they themselves had done something wrong. But you see, you were so correct when you said, it's a pandemic of sorts. Because when you find out that more broadly, WHO speaks about especially violence against women, which I've been working on, as a case of 1 in 3 women and girls have suffered one form of violence or the other. So we were speaking of this violence against women of pandemic proportions and an existential threat, a human rights and a public health issue. Enter COVID. We gave it the name a pandemic within a pandemic. Guess what the Secretary General of the United Nations called it? He said, there needs to be a ceasefire behind the closed doors of our homes. So you can imagine, I always associated ceasefire with wars and guns and tanks, but the Secretary General called for a ceasefire. The United Nations entity for women, UN Women, actually called it a shadow pandemic. So, going back to your point about the stigma and the shame, where the survivors or the victims feel that, they must have done something wrong and, not able to speak about it.
Thank you.
In Ireland, we had a study much earlier than your one, Dr. Eleanor, in 2002. And when that study came out, it was called the SAVI Report, Sexual Abuse and Violence in Ireland. And we've had a huge problem in trying to have a second SAVI. I'm glad to say government have now committed to it. But the Professor Hannah McGee, who led that report, said that what this report showed was that the systemic abuse of women and children, that people aren't going to believe it, and actually that's what happened. The report, like it took so long, a number of years, for that report to be accepted as. And now of course it is accepted, and I'm glad to say the only way we can address this is to ensure that we have the governments are committed. Like you said, we do need a ceasefire, but it's going to take time, and we need to have all of government response to this problem, working with the NGOs, who are the ones, of course, who acted and were the advocates for the victims and survivors. They're the ones who set up the rape crisis centres, the domestic violence services. But we now need governments to take responsibility, because this is a societal problem, and it has to be government have to respond to this. I took part recently in looking at Ireland's the state response to domestic, sexual and gender-based violence, and it's to inform a new strategic plan to address it. And also, I'm not sure if you know about I'm sad to call it the Istanbul Convention, but it's the European Convention on the Prevention of Domestic, Sexual and Gender-Based Violence. And the 3 prongs of it are about prevention, protection and provision of services. They're the main thrusts. But unfortunately, Turkey, who was the first signature of the convention, that's why it's called the Istanbul Convention, they now have pulled out of signing this really important convention for the protection of and the provision of services and the prevention. And it is so important in today's world that we all support this all of government response, because it is society's problem and everybody has responsibility for it.
I'm curious to hear what your take is. As I hear you guys, clearly this problem is multidimensional. It needs to be addressed at the personal level, family, communities, workplace, then community, and then at government level on that. I'm curious to hear, especially with pandemic, it is clear and data shows that women being the primary caretakers, caregivers in most situations were the ones most impacted with the pandemic and isolation, preventing them to go to work, to participate in work or thrive at work, and also leading them with increased exposure and at risk with their abusers at home. In your mind, what can the workplaces, the businesses, the leadership do to be more vigilant about it, to create the support structure or participate in policy or policy or systemic changes? What can the businesses and the leadership do? Anybody? I'm going to leave it at that. Samira, welcome back. Looks like you had some network issues.
Yes, I did. I'm sorry about that.
That's okay.
Yes. Welcome back, Samira. I'll jump in here, first of all, to talk about how important it is, and Helen, alluded to that, and yourself. It has to be an all of government and all of society approach.
Mm-hmm.
And that's why, we are advocating for a global treaty to end violence against women and girls, of which domestic violence is a part. Why do we need a global treaty? The first thing is, take, for example, the tobacco treaty.
Mm-hmm.
Whether you're hopping on a plane in Ireland or in South Asia or in Nigeria or in the UK, there will be no smoking on that aircraft. It's because there is a global treaty called the Tobacco Treaty. Ellen, thank you for mentioning Istanbul. Istanbul has a good text as a convention for Europe. In Africa, we have the Maputo Protocol. In South America, there's the Bellum de Para. But here's the thing. You put all those three regional conventions together, and they leave out 75% of women in the world because they are regional. They're not global. Then, quite recently, 2 years ago, we had the Sexual Harassment in the Workplace Convention called the C190. A new convention, but limited to harassment in the workplace, where, as you were asking, Shaillee, you need to have the policies in place, you need to have from the board right down to the receptionist in the office, who everybody is an ambassador of the establishment that needs to look at that avoidance of violence in the workplace. And I just want lastly to say, unless and until we have a global convention, a lot of people would know about the Convention on the Elimination of Discrimination Against Women. Guess what? It's called Cedaw for short. A lot of people don't know that even though it was the first convention protecting women against discrimination, it's 40 years old, but the word violence was not mentioned in that convention because violence was thought to be a private matter. Now that there's been this exponential rise in violence, there's been an attempt to retrofit violence into the text of Cedaw. But before you can go before the Cedaw committee as an individual, You need to have exhausted domestic remedies. You need the financial resources. There is no confidential reporting. So Cedaw for 40 years has been perfect for discrimination. But if today the violence perpetrated against you is not within the discrimination framework, then the Cedaw committee cannot address it. So I cannot emphasize enough how, if we have a global treaty to end violence, including domestic violence, therein lies the answer.
Thank you, Eleanor. I really appreciate you thinking globally, but I would also like to address this, like Shaillee, as you mentioned, what are being done in our national level, state level, and what should be done by the government. We do have a lot of resources in place. We do have an ally in the White House now. We have a national domestic violence hotline. We have immigration laws that are recourse to survivors, that provides recourse to survivors. We have a lot of legislation in place. We have a lot of federal funding, but unfortunately, when the federal funding trickles down to the state and local level, it's often decentralized, and there's no system to hold people accountable to be in compliance for the federal rules and regulation, which is a problem. There are rules and remedies in place, but local stakeholders, local government officials are not able to provide equitable service and provide those remedies for women from marginalized communities, from people who need language access, people who are unable to access technology to seek help. Every corporation office, whether it's government, federal offices, state offices, and also private corporations, should have policies in place to first believe the survivor, to be non-judgmental, to be able to not victim blame, and then have places when it becomes policy from the top, it trickles down and everybody is held accountable to help the survivor. Our community should believe the survivors. Our communities should be a safe haven, and it should break patriarchy and help and believe the survivor in a non-judgmental way. That would be my take on this question.
You know, Samira, I so appreciate you saying that. I reflect upon many, not too far back, mental health was a topic of stigma. It still is. We still have ways to go, but look at in our workplaces, most businesses, if not all, include an EAP hotline, confidential hotline where people can reach out and get services. And I wonder if the silent pandemic that we have, it needs to be expanded out to, have that safe space to talk, to learn how to leverage help, where to reach out to. And then to your point, really calling it out that yes, we support and we stand against it. And yet we stand with the survivors, being part of that to encourage, give confidence to more and more people to reach out to. Ellen, your take?
I just like to come in there. I think it's really important that we address this problem at all levels.
Yeah.
I think education is a really important piece. And I think education, I'm talking about right from preschool through to third level, age related in terms of relationships and how and respect of each other. Those kinds of people might say they're those type of things are dated, but actually they're at the core. And that's where, because the children, we like children experiencing domestic violence, they think this is the norm. And then they go on, of course, to repeat. Now, not everybody repeats, but it is so important that we start as early as possible. Parenting programs, preschool right through to third level. That is, again, I think, imperative right across the board. Awareness raising campaigns. You talked about how do we get to a place where we had no smoking? You know, how do we get to that place? This is where we need to get to a place. No violence, no more violence against women. It's just got to stop.
I totally agree with you, Ellen, and the importance of community education and outreach at every level, whether it's at school, with the law enforcement, the medical professionals, and also with, you know, all the stakeholders in the community, so that they recognize it. And early prevention is critical, because once the children learn that pattern, and it's a learned behavior, abusing and accepting abuse, so the cycle repeats and it goes on to the next generation, and it affects the whole community and the health of the community.
But we need the education at all levels. We need judges to be educated, you know, because that is, of course, what is happening in the community is repeated at all levels. So, and in fact, we saw an increase in reporting to what we call, our police here are called the Gardaí. They're guardians of the peace. And, and we saw an increase when the guards, our police, had training. An imperative and part and parcel of their training is training in domestic, sexual and gender-based violence. Now, because of the pandemic, of course, they weren't getting the training because we could, and the type of training I'm talking about is not giving a lecture. It's actually ensuring that there are small groups and that they are seminars, and that you get a sense, the trainer gets a sense of the attitudes that, of course, are going to be repeated in the guards, are going to be repeated in the judiciary, right across the judicial, right across our criminal justice system. They also need to ensure that we need to ensure that they get exposed to the trainings that are there.
It's amazing that, you know, you've just so eloquently described what we call the whole hand framework, where we say you start with the reforming laws. Yes, laws are not the be all and end all in and of itself, but if you don't start with laws, then you can't, you know, reform the situation. Then we talk about training of doctors, nurses, lawyers, magistrates, the police, all those who respond. Because sometimes you might have a survivor go to the police and the police re-victimizes. And then you have to have appropriate services, the things that you've spoken about, you know, the shelters, the hotline, make sure that there's economic empowerment, all the support that the survivor needs. And the one that has made the most impact is the prevention education. But you see, you can't do all these unless you have dedicated funding. There has to be set aside, ring-fenced funding specific by the government to address violence. Guess what? For violence against women and girls, guess how much is spent per female for the entire development community? It is 11 cents per female per year when you put the entire funding to prevent violence against women and girls. And yet when a woman or girl suffers violence and you need to now provide services, etc., for each female, you need to bring out at least $1,200 in order to address the fact that she has been violated. So it just doesn't make economic sense. And then the palm of the hand is monitoring and data, so that we have data-driven information in order for us to respond appropriately. So you would have seen me smiling because you just both described eloquently what, you know, we call the whole hand framework for the global treaty.
Thank you.
You know, another one that I and it's my personal journey that I speak to it, is monitoring and data and having all these aspects of the whole hand framework, is to normalize the conversation about it, the stories. The more we allow for a safe platform to talk about it, to talk about journeys, to talk about personal journeys, more we normalize this conversation. You know, one of you had mentioned it's intergenerational. Indeed it is. Normalizing abuse, accepting it or giving it. I know in my culture growing up, it was normalized. I love my parents, but it was normalized. That anger, that volatility was normalized. Nobody taught me how to accept abuse, but it was something that I had embraced. I'm an educated woman, a strong woman. I know it's wrong, but when you're in the situation, you default to your subconscious behaviors, what you had learned. So I normalize it. And by me normalizing it, I am propagating the cycle and setting an example for the next generation that it's normalized. So how do we break that cycle? And how do you go through the journey of breaking that cycle, the ups and downs of it, because it is not bed of roses on that. So the more we have conversations around it, structured, informal. We live in a digital world right now, leveraging the power of digital platforms to amplify these stories. I think it's going to help more and more people to come out on it. I mean, I know it's especially true for South Asian culture I belong to. It is a taboo subject. It is something we don't talk about. So we need to give it voice. And I know it's not just South Asian culture, it's many more cultures there too.
I totally agree with you, Shaillee. In our cultures, we don't even have a formal word for domestic violence.
Mm-hmm.
So terminology is missing. So when we do not like to talk about a topic, we do not even provide language. So it is a message sent out clear that this is a taboo topic, let's not talk about it. But I'm so glad that these conversations are happening. At our agency, we have a robust community education team who's engaging on social media in the pandemic, because that's the only way, right? To have these deep dives and these conversations. But unfortunately, the people who need it the most do not have the technology access, or might not have the language access to understand and engage in the conversation, and their voices are getting missed. So what is our agency doing? One of the strategies is to engage on WhatsApp and WeChat and the other little groups that each community engages on, or Viber, because each community kind of galvanates to one or the other. And having those discussions on those platforms with language access in their language. So WeChat, if Vietnamese folks like to use WeChat, it's in Vietnamese, and WhatsApp, it's in other Indian languages or South Asian languages. So it's very grassroots level, because that's where the real work needs to be done, because otherwise people will find themselves so isolated and unable to reach for services.
Dr. Eleanor or Ellen, in your opinion, what can we continue to do at the grassroots level to make this change, to impact this?
I do a lot of work at the grassroots level, and how correct you are. Providing a safe space for survivors, for generations, to tell their stories in a way that does not portray them as, victims, but more as those who are empowered. I listened to somebody recently who said, I hold my power within me. I don't need to wait for another person to give me power or empower me. So it's for them to realize that they hold that power themselves. Very quickly, I came to this work working with widows who were going through harmful practices in Nigeria. And I had this misconception that, we were looking at, elderly women, menopausal women, until I came across child widows. So this has to be intergenerational. Where you have child marriage, if that child loses her husband, she's 9, she's 10, most times married to somebody in their 60s, sometimes in a polygamous relationship. When that husband dies, you're left with a child widow. You're left with children who have themselves born children. So it's about letting them recognize the power that they have within, and, not constantly, giving them the impression that they cannot break out of that cycle. There's a spinning top, and if you spin that top within a confined space, it will go round and round and hit the wall and stop. But once you make sure that space is not confined, it will spin a lot longer and spin in a way that will even surprise you, the spinner. So especially at community level, where we're seeing, domestic violence perpetrated against individuals of all ages, provide that safe space for the stories to be told and for them to know that there is that power within them.
That's so beautifully said.
I think that as well as that, though, I think we have to create spaces for people to tell their stories. However, sometimes people don't even get to that.
Mm-hmm.
And I think this is where community can help in terms of, for example, if you're and you hear next door a terrible battle going on. In the past, I think people denied that this was happening or denied that they had any responsibility in doing anything about it. So that bystander, needs to speak up, and that can help facilitate somebody getting to a place where they feel safe enough to be able to explore and begin to access their own power. So I think, there's so much we can do at community, in families, and at community level. These are the building blocks.
I so agree with you, Ellen and Eleanor. I often tell our survivors and community folks that you are the first stop. You are where the survivor will come first. We will not be the first stop like agencies like ours. And that is when the community folks should know how to refer a survivor to a professional, because often community folks take on the responsibility of helping the survivor, and the power and control shifts from the abuser to this person who says that you have to do what I ask you to do, or you have to follow my instructions and guidance, and if not, there are consequences, right? So there's a difference between a survivor being helped by a professional versus a community member. But that's where the community needs education, that they are going to be the first stop, but it's important that they seek professional help.
That's so true, Samira. I mean, I reflect on my journey, and I did reach out to friends, your first line of defense, right? When you talk about it, and very well-intentioned, deeply loved me, but they did not know what to do except to just ignore. Oh, this must be a private family matter on that. So to your point, and as I've gone through the journey and as I talk about it openly, many of my friends and community members have come back and said, how can we educate ourselves? So next time, if I see it, if somebody comes to me or I suspect, I can actually be part of the solution. Then to have to turn away because I did not know how to talk about it, what to say, where to refer, not because there was a lack of concern. So that education, that communication, I think it needs to come down all the way to the grassroots level for this change to be effectuated on that at many levels. We have just about 10 minutes left here, and I know Mim is going to join us shortly. We've talked about how the systemic change needs to happen at the government level policy, but then it needing to come down at the community level, from education, from training, from services, infrastructure. We need to have data to be able to measure this problem. If we can't measure it, we cannot change it. But then we have to bring it down to the grassroots level at the front lines with the conversations, with creating safe space for conversations, and with educating people on how to reach out as a survivor or how to help somebody who's needing help. And even our workforces or work leadership plays an important role in that, even though they might not traditionally see themselves having a role or a voice in this taboo subject, they indeed play a different role. Any parting thoughts, words each one of you might have for our audiences who's listening? Samira, I'll start with you.
Well, I would say that together we are stronger. So if we continue to have these dialogues at the systemic level, at the grassroots level, at the community level, and also to include other movements against violence, like which has organically happened in the United States in the last year, right? Because of the incidents of violence, like the Black Lives Matter movement, Stop Asian Hate movement, and people are talking, people are coming together. There are rallies, there are vigils, there are memorials, and there is an intersection between the systemic oppression that leads to all these kinds of violence, whether it's gender-based, whether it's homophobia, whether it's against races, and all the isms that we have in place. So together, if we work and collaborate and continue to have these dialogues, we are stronger. And I see that at work every day, women who are breaking patriarchy and are refusing to lead a life of violence and come out, reclaim peace and dignity and joy for themselves and their families. They are getting a job, and it gives me such joy to see that empowerment and the reclaiming their power, as Eleanor and Ellen said. So I think we are on the right track. A lot of work needs to be done, but let's have more of these conversations.
Wonderful. Dr. Eleanor, would you like to go next?
Oh, most certainly. To say that, yes, we need to band together in these convenings, whether it's your circle of influence or whatever those circles are. And it is when we are able to remove that seeming gag order. Let's hear the voices from local to global. Let's hold our governments accountable. We want our governments to take that bold step of cleaning up. I want my grandchildren and great-grandchildren to stand and wonder in awe that there was ever a time that this sort of violence was perpetrated. And as I always say, elbows locked, we move to the finish line together. If our elbows are not locked, somebody might bump into us and we might miss a step, but with our elbows locked together, we'll get to the finish line.
Beautiful.
I agree wholeheartedly with you, Dr. Eleanor, and also with Samira. And I suppose the bit that I would add is I think it's really important that the resources are made available for us to tackle this. I also think we need to enlist the good men that are around as well, because I suppose being the mother of 4 sons, and glad to have six granddaughters. I want life to be a lot better for them, and it is possible. And there are good men, and there are also men who are victims, and we mustn't forget that either. But it's only together that we can, and I like that idea of locking elbows together, and not to be siloed. I think that is really important, that we move out of silo thinking and silo working. This is something that we can deal with if we come out of those silos and work together.
Beautifully said. Beautifully said. This conversation fills my heart, gives me hope, and I'm hoping anybody listening on here, you are also invigorated to do your bit to be part of this movement, to add your voice, because it will take all of our voices, all of our commitment to change the tide on the silent pandemic. And I firmly believe we can. It all starts with commitment of one, which certainly at this table, we have these three fantastic, powerful women with their passion and commitment to be part of the solution. So I thank each one of you for your time and your wisdom and your sharing. So appreciated. Ma'am, I'll pass it on to you.
Oh, what an incredible conversation. And to get to hear this through different cultural lenses, I think it just helps us really kind of understand what the scope of the issue is, but just so appreciate the multi-level approach and some of the practical things that we can do. I just want to call out that Olga Atwood, who's listening, we didn't really touch on this as much, but we have to think about this through the elder abuse lens as well, and older women. And as we always say at GW4W, so appreciate everybody's view of this. We are stronger together. We each bring this beautiful strength and knowledge, but when we lock elbows, as you say, Dr. Eleanor, and as we say, we do more good together, it will make a difference for this next generation, for that 6-year-old girl and boy, and present a world that is much more inclusive. The world needs more healthy female leaders desperately with some of the big, giant, hairy problems. And this is one of the key issues that we have to address, so that female leaders can come and contribute and be part of the conversation and part of the solution. We all win as a world when that happens. And it is this constant conversation, and not just conversation, but action steps. So I would challenge everybody listening, either to this live or the recording, choose something to do today. If you know of somebody and you think that they're being abused, please reach out to them. If you are a leader in your organization, think about advertising domestic abuse hotlines, putting them in places, in bathrooms in your organization. It's a simple thing you can do. One of the things that I just recently read about that I'd ask all of us to start pushing for, and I didn't really think about this, when we talk about cell phones and family plans, is women who are trying to leave, or men, anybody who's being abused trying to leave, them not being able to take their phones, and the pushback by these providers not allowing women to do that. And that cuts you off if you don't have in our world. So it's just a piece that became clear to me, like, oh my gosh, well, if somebody's leaving and they can't take their number, which is what their network knows about, and they can't break out of that family plan, that's just a practical thing that we can start to force organizations that provide these contracts. They need an out clause. They need to be able to do something so that they have access to their phone and are not cut off. But it is, clearly a growing issue. The past 14 months have just underscored how important it is. And all of us on this call and beyond, the data is there. The data is there. What action steps are we going to take? How are we going to measure success? And how are we going to share something great that happens in South Africa? Hey, can we use that in India? Something in India that's awesome. Can we share that in Japan? Maybe you have to look at it different culturally. But these conversations help us become more educated. They help us hopefully become more passionate about making real change for this next generation. And like you, Shaillee, I have so much hope, because every time we do this, you start to realize just how many extraordinary leaders there are out there saying, let's do this, let's make this change happen. And so it's hope. It's hope for all of us and for our future. We cannot thank you enough for your leadership, your voice, your advocacy, and educating us. And we hope that down the road you'll join us again, and we'll continue this conversation and talk about the wins. And we also want to just invite our audience, please join us at GW4W. Our mission is to empower more healthy female leadership at all levels.